Step into the front office of a typical medical practice today, and you will see an operational system under extreme stress. In-house staff are attempting to balance patient flow alongside a never-ending stream of blinking notifications, prior authorizations, and inbox tasks. Inside the NextGen EHR specifically, this animated clock illustrates exactly how that administrative burden travels downstream to the clinical team. Primary care physicians now spend nearly 6 hours per workday inside the EHR. That averages out to 36.2 minutes of screen time for every patient visit. Because clinic hours are packed, a portion of that documentation spills over into the evening. Researchers call this pajama time, an average of 6.2 minutes of after-hours EHR work per visit. This overwhelming volume of manual tasks acts as a systemic bottleneck. The resulting fatigue actively drives burnout, with over 43% of physicians reporting symptoms in 2024. That high-pressure environment hits the front office teams hardest. According to the Medical Group Management Association, frontline support staff experience a severe 40% turnover rate, making medical assistants and front office roles the #1 turnover hotspot in healthcare. This chart maps the immediate financial penalty of that attrition. When a practice factors in recruiting expenses, onboarding time, and lost productivity during the gap, replacing a single frontline support staff member costs between $9,000 and $30,000. The operational disruption hits even harder. NextGen is a powerful platform, but it requires staff trained on the exact protocols, task types, and escalation paths of your specific practice. Every time someone quits, that highly specific knowledge walks out the door, generating downstream errors while the new hire learns the ropes. Even when staff stay, keeping this work in-house carries a heavy premium. Base salary, benefits, payroll taxes, time off, and management overhead stack up to an estimated $60,800 annually for a single full-time hire. Practice owners are currently paying top-tier, fully loaded salaries for an unstable, error-prone operational structure that constantly requires rebuilding from scratch. To solve this, smart practices are smoothly separating their routine EHR tasks from the physical front desk entirely. They achieve this through outsourcing partners like Staffingly. The model relies on dedicated full-time virtual assistants assigned specifically to one practice, not a rotating pool of temporary agents handling generic tasks. These specialists integrate natively into NextGen, or over 40 other major platforms like Epic and athenahealth. They learn the exact documentation protocols and patient population of your practice, driving deep consistency. Oversight is built directly into the structure. Each practice gets a team leader, a process manager for quality compliance, and a customer success manager. Removing high-volume, repetitive NextGen tasks from the busy clinic floor instantly restores bandwidth to in-house teams, allowing them to focus entirely on the patients sitting in the waiting room. Practice owners naturally question data security when moving workflows off-site. However, remote, structured workflows reliably operate with higher security standards than a distracted, busy front office. This infrastructure completely secures your data. Every specialist operates behind distinct digital gates, mandating strict HIPAA compliance, SOC 2, and HITRUS workflows. Once secure, an intelligent routing system leverages AI to instantly match each incoming task to the specialist with the best proven track record. Behind the scenes, automated models flag anomalies and score accuracy before a human even reviews it. This frees the human experts to apply their clinical judgment exclusively to complex edge cases. Combining deep human EHR expertise with automated, intelligent error checking effectively eliminates the compliance risks and revenue leaks common in purely manual workflows. When you apply this optimized workflow to the practice's balance sheet, the financial shift is immediate. This comparative chart breaks down the actual numbers. An in-house hire totals roughly $60,800 per year. Staffingly's dedicated virtual assistant costs exactly $21,600 per year. That difference delivers a massive $39,200 annual savings, a 64% cost reduction per role. This lower cost model consistently outperforms localized staffing. Across more than 800 healthcare providers nationwide, Staffingly maintains an operational error rate below 1%. Outsourcing NextGen operations offers a rare mathematical corrective. Practices drastically cut their operational overhead while simultaneously upgrading their task accuracy. Implementing this system requires very minimal downtime. A dedicated NextGen specialist can be fully set up and live inside a practice's EHR within 48 to 72 hours. The commitment is completely flexible. There are no long-term contracts. Engagements run month to month and require only 30 days' notice to scale up or cancel. Practice owners do not need to accept burnout and constant turnover as the standard cost of doing business. You can calculate your exact savings and explore a risk-free pilot with a free consultation today.